Hi everyone, I'm Nurse Marcia, and today we'll tackle an NCLEX-RN Next Generation NGN mock test with essential questions on burns, respiratory, cardiac, and more. I'll present the questions first, and at the end, we'll go over the answers and rationales. Grab a notebook and let's get started. Questions 1 to 5. Client profile. A 58-year-old male presents to the ED with severe shortness of breath, cyanosis, and accessory muscle use during breathing. Vital signs: HR 120 BPM, RR 32 per min, BP 150 over 90 mmHg, SpO2 82% on room air. 1. What is the nurse's immediate priority action? A. Apply a non-rebreather mask. B. Administer a bronchodilator via nebulizer. C. Position the client in supine position. D. Start IV fluids. 2. Based on the client's condition, which ABG result is most likely? A. pH 7.30, PaCO2 55, HCO3 26. B. pH 750, PaCO2 30, HCO3 22. C. pH 7.28, PaCO2 40, HCO3 18. D. pH 7.38, PaCO2 40, HCO3 24. 3. The client's SpO2 improves to 90%, but he exhibits increased accessory muscle use and a HR of 140 BPM. What is the next priority action? A. Prepare for intubation. B. Increase oxygen flow rate. C. Administer corticosteroids. D. Perform chest physiotherapy. 4. What adverse effect of a bronchodilator should the nurse monitor for? A. Hypotension. B. Bradycardia. C. Tremors. D. Hypoglycemia. 5. Discharge teaching. Which statements indicate understanding? Select all that apply. A. I will use my prescribed inhalers daily. B. I need to avoid smoke and dust. C. I will eat more high-carb meals for energy. D. I should get vaccinated for flu annually. E. I will check my oxygen levels daily. Questions 6 to 10. Matrix question. Scenario. A client is admitted with septic shock, MAP 55 mmHg, HR 130 BPM, lactate 4 mmol per L. Select appropriate interventions. Intervention, appropriate or not appropriate. 1. Administer a 500 ml bolus of 0.9% NS2. Start norepinephrine infusion 3. Obtain blood cultures before antibiotics. 4. Administer acetaminophen for fever. 5. Give IV potassium chloride. Drag and drop question. Scenario. Place the following nursing actions in order for a client with chest pain. A. Administer oxygen. B. Attach ECG leads. C. Obtain vital signs. D. Administer nitroglycerin. E. Notify the healthcare provider. Correct order. Okay. Questions 11, 15, 11. A client receiving a blood transfusion reports chills and lower back pain. What is the nurse's first action? A. Stop the transfusion immediately. B. Notify the healthcare provider. C. Check vital signs. D. Send the blood bag to the lab. 12. Select all that apply. A nurse is caring for a client with potassium 6.5 μQL. Which interventions are appropriate? A. Administer calcium gluconate. B. Start IV potassium chloride. C. Administer sodium polystyrene sulfonate, KXylate. D. Provide IV insulin with dextrose. E. Restrict dietary potassium. 13. A nurse reviews ABG results. pH 7.29, PaCO2 50, HCO3 26. What does this indicate? A. Respiratory acidosis. B. Metabolic acidosis. C. Respiratory alkalosis. D. Metabolic alkalosis. 14. A postpartum client saturates a peripad in 10 minutes. What is the nurse's first action? A. Perform a fundal massage. B. Notify the healthcare provider. C. Start an IV fluid bolus. D. Administer oxytocin. 15. A client with heart failure reports weight gain of 4 pounds overnight and dyspnea. Which intervention is priority? A. Administer IV furosemide. B. Restrict fluid intake. C. Notify the healthcare provider. D. Increase dietary potassium. Questions 16 to 2016. A nurse is preparing to administer digoxin to a client with heart failure. Which finding requires the nurse to withhold the medication and notify the provider? A. Apical pulse of 55 bpm. B. Serum potassium of 4.0 mq per L. C. Blood pressure 120/80 mmHg. D. Sodium level of 140 mq per L. 17. A nurse is caring for a client with sepsis who has a MAP of 55 mmHg, HR 120 bpm, and lactate 4.5 mmol per L. What is the nurse's priority intervention? A. Administer a fluid bolus of 500 mmol 0.9% NSB. Start norepinephrine infusion. C. Draw blood cultures. D. Initiate broad-spectrum antibiotics. 18. A nurse reviews the telemetry monitor and notes a wide QRS complex with a rate of 160 bpm in a client reporting dizziness. What is the priority action? A. Administer IV amiodarone. B. Perform synchronized cardioversion. C. Check the client's blood pressure. D. Start CPR. 19. A postpartum client reports severe perineal pain despite medication. On assessment, the nurse notes a swollen, tense area at the perineum. What is the nurse's next action? A. Notify the healthcare provider. B. Reassess in 30 minutes. C. Apply an ice pack to the area. D. Administer additional pain medication. 20. A client with chronic kidney disease has a potassium level of 6.5 mq per L. Which prescription should the nurse question? A. IV insulin with dextrose. B. Sodium polystyrene sulfonate, Kayexalate. C. Spironolactone 25 mg PO. D. Furosemide 40 mg IV. Questions 21 to 25. 21. A nurse is teaching a client about a new prescription for warfarin. Which statement indicates a need for further teaching? A. I should avoid foods high in vitamin K, like spinach. B. I will monitor for signs of bleeding, such as bruising. C. I should take aspirin if I have pain while on this medication. D. I will have my INR checked regularly. 22. A client with myasthenia gravis is experiencing respiratory distress. What is the nurse's priority intervention? A. Prepare for intubation. B. Administer pyridostigmine. C. Position the client in high Fowler's. D. Start non-invasive ventilation. 23. A client is admitted with severe burns covering 40% of the body. The nurse notes a BP of 88/50 mmHg, HR 130 bpm, and pale, cool skin. What is the priority intervention? A. Start a lactated Ringer's infusion. B. Administer I4 morphine for pain. C. Cover the burns with sterile dressings. D. Monitor urine output hourly. 24. A nurse is caring for a client receiving a blood transfusion. The client reports chills and lower back pain. What is the nurse's first action? A. Stop the transfusion immediately. B. Notify the healthcare provider. C. Check vital signs. D. Send the blood bag to the lab. 25. A client with heart failure has the following data: weight gain of 3 pounds in 24 hours, crackles in the lungs, and decreased urine output. A. Administer IV furosemide. B. Encourage fluid restriction. C. Notify the healthcare provider. D. Provide oxygen therapy. Questions 26 to 30. 26. A client has the following ABG results: pH 7.29, PaCO2 50, HCO3 26. What condition does this indicate? A. Respiratory acidosis. B. Metabolic acidosis. C. Respiratory alkalosis. D. Metabolic alkalosis. 27. A nurse is educating a client with COPD about oxygen therapy. Which statements indicate correct understanding? Select all that apply. A. I should wear my oxygen during sleep. B. I can increase my oxygen flow rate if I feel short of breath. C. I will avoid smoking while using oxygen. D. I can use petroleum-based products near my oxygen equipment. E. I should notify my provider if my oxygen saturation drops below 88%. 28. A client with newly diagnosed hypertension is prescribed lisinopril. Which adverse effect requires the client to stop the medication and notify the provider? A. Dizziness. B. Persistent dry cough. C. Facial swelling. D. Fatigue. 29. A nurse is monitoring a client who has undergone a thoracentesis. Which finding requires immediate intervention? A. Pain at the puncture site. B. Diminished breath sounds on the affected side. C. Oxygen saturation of 94% on room air. D. Blood-tinged sputum. 30. A nurse is preparing to administer enoxaparin, Lovenox. Which client statement indicates a need for further teaching? A. I will inject this medication into my abdomen. B. I should avoid taking aspirin while on this medication. C. I will monitor myself for signs of bleeding. D. I will rub the site after the injection to prevent bruising. Questions 31 to 35. 31. A client reports persistent leg pain following a surgical procedure. The nurse notes the leg is swollen, red, and warm to touch. What is the nurse's priority action? A. Apply warm compresses to the affected area. B. Elevate the leg above heart level. C. Notify the healthcare provider immediately. D. Administer prescribed pain medication. 32. A client with a history of heart failure is admitted with the following data: BP 150, 92, mmHg, HR 110, BPM, SpO2, 90% on room air, weight gain of 5 pounds in 48 hours, and crackles in both lung bases. What is the nurse's priority action? A. Administer furosemide IV push. B. Restrict fluid intake. C. Encourage the client to ambulate. D. Increase oxygen to 6-LMN via nasal cannula. 33. A nurse is administering IV vancomycin to a client with a severe bacterial infection. During the infusion, the client develops flushing and itching of the upper body. What should the nurse do first? A. Stop the infusion. B. Administer diphenhydramine IV-C. Reduce the infusion rate. D. Notify the healthcare provider. 34. A client is scheduled for surgery and is found to have a potassium level of 6.2 μQ per L. Which action is priority? A. Administer sodium polystyrene sulfonate, Kayexalate. B. Notify the surgical team to postpone surgery. C. Monitor the client for dysrhythmias. D. Prepare the client for hemodialysis. 35. A nurse is caring for a postpartum client who reports difficulty breastfeeding. On assessment, the nurse notes the breasts are engorged and tender. Which intervention is appropriate? A. Apply ice packs to the breasts after feeding. B. Encourage the client to limit breastfeeding to 5 minutes per side. C. Massage the breasts and express milk manually before feeding. D. Advise the client to switch to formula feeding. Questions 36 to 40. 36. A client with acute pancreatitis reports severe abdominal pain. Which intervention should the nurse implement first? A. Administer IV morphine as prescribed. B. Position the client in a semi-Fowler's position. C. Provide small, frequent meals. D. Encourage deep breathing exercises. 37. A nurse is caring for a client with a urinary tract infection, UTI. Which of the following is the priority intervention? A. Administer prescribed antibiotics. B. Increase oral fluid intake. C. Encourage frequent voiding. D. Obtain a urine culture. 38. A client is admitted with acute decompensated heart failure. Which diagnostic finding requires immediate intervention? A. BNP level of 800 pg per ml. B. Potassium level of 3.0 MEq per liter. C. Ejection fraction of 35%. D. Oxygen saturation of 89%. 39. A nurse is caring for a client with burns covering 30% of the body. The client is in the emergent phase of burn management. Which finding is most concerning? A. Hematocrit of 50%. B. Potassium of 5.8 μQ per liter. C. blood pressure of 86/48 mm Hg. D. Heart rate of 110 BPM. 40. A nurse is preparing to administer a scheduled dose of metoprolol to a client with hypertension. The client's vital signs are BP 118/78 mmHg, HR 58 BPM. What action should the nurse take? A. Hold the medication and notify the provider. B. Administer the medication as scheduled. C. Recheck the client's blood pressure in 30 minutes. D. Assess for orthostatic hypotension. Questions 41 to 45. 41. A client with a history of rheumatoid arthritis reports severe pain and swelling in multiple joints. The nurse notes redness and warmth in the joints. Which action should the nurse take first? A. Administer prescribed NSAIDs. B. Apply ice packs to the affected joints. C. Encourage range of motion exercises. D. Notify the healthcare provider. 42. A client undergoing chemotherapy has a WBC count of 1/500 per micro-L. What is the nurse's priority action? A. Administer prescribed antibiotics prophylactically. B. Initiate neutropenic precautions. C. Encourage a high-protein diet. D. Monitor the client's temperature every 4 hours. 43. A nurse is caring for a child with suspected epiglottitis. The child has a high fever, drooling, and inspiratory stridor. What is the priority action? A. Administer nebulized epinephrine. B. Obtain a throat culture. C. Notify the healthcare provider immediately. D. Position the child supine for airway assessment. 44. A client with a new colostomy expresses concern about managing the ostomy at home. What is the best response by the nurse? A. You will receive support from a home health nurse. B. It will become easier with practice and time. C. Let me teach you how to empty the ostomy pouch. D. You should reach out to a support group for colostomy care. 45. A nurse is assessing a client with a chest tube following thoracic surgery. Which finding requires immediate intervention? A. Continuous bubbling in the water seal chamber. B. Serosanguineous drainage of 50 milliliters per hour. C. The chest tube is secured to the chest wall. D. The client reports mild pain at the insertion site. Questions 46 to 50. 46. A client with type 2 diabetes mellitus presents with blood glucose of 450 mg per dl and deep rapid breathing. Which lab results should the nurse review next to confirm the suspected diagnosis? A. Serum osmolality. B. Urine ketones. C. Glycosylated hemoglobin, HbA1c. D. Serum potassium. 47. A client with a history of atrial fibrillation is receiving warfarin therapy. Which statement by the client indicates a need for further teaching? A. I will avoid eating too much spinach and broccoli. B. I will take the medication at the same time every day. C. I will stop taking my medication if I notice bruising. D. I will have my INR checked regularly. 48. A nurse is caring for a client with Guillain-Barré syndrome who reports increasing difficulty breathing. What is the priority nursing action? A. Place the client in a high Fowler's position. B. Assess the client's vital capacity. C. Administer supplemental oxygen. D. Notify the healthcare provider. 49. A client with pneumonia is receiving IV antibiotics. The client's latest lab results show a BUN of 28 mg per dl and creatinine of 1.9 mg per dl. What is the priority nursing intervention? A. Encourage increased oral fluid intake. B. Notify the provider of potential nephrotoxicity. C. Hold the next dose of antibiotics. D. Monitor the client's intake and output. 50. A nurse is caring for a child with newly diagnosed cystic fibrosis. Which intervention should the nurse include in the plan of care? Select all that apply. A. Administer pancreatic enzymes with meals. B. Encourage a low-calorie, low-fat diet. C. Perform chest physiotherapy twice daily. D. Increase fluid intake throughout the day. E. Monitor for signs of respiratory infection. Questions 51 to 55. 51. A postpartum client develops a temperature of 101.5 degrees Fahrenheit, 38.6 degrees Celsius, and reports lower abdominal pain. The nurse notes a foul-smelling vaginal discharge. What is the priority intervention? A. Administer prescribed antibiotics. B. Encourage fluid intake to promote hydration. C. Perform perineal hygiene and change pads frequently. D. Notify the healthcare provider immediately. 52. A nurse is caring for a client receiving TPN, total parenteral nutrition. The client's blood glucose is 240 mg per dl. What is the nurse's priority action? A. Slow the TPN infusion rate. B. Administer sliding scale insulin as prescribed. C. Recheck blood glucose in 30 minutes. D. Notify the healthcare provider. 53. A client with a nasogastric NG tube for decompression following abdominal surgery reports nausea and abdominal distension. What is the nurse's next action? A. Irrigate the NG tube with normal saline. B. Reposition the NG tube. C. Check the patency of the NG tube. D. Advance the NG tube by 1 to 2 inches. 54. A client receiving chemotherapy reports oral discomfort and difficulty eating. On assessment, the nurse notes white patches on the client's tongue. What intervention should the nurse implement? A. Provide a soft toothbrush for oral hygiene. B. Administer nystatin as prescribed. C. Encourage the client to eat acidic foods. D. Rinse the mouth with hydrogen peroxide solution. 55. A nurse is reviewing lab values for a client receiving heparin therapy. The client's APTT is 90 seconds. What is the nurse's priority action? A. Stop the heparin infusion immediately. B. Increase the infusion rate as prescribed. C. Administer protamine sulfate as prescribed. D. Notify the healthcare provider. Questions 56 to 60. Trend question. Review the following data for a client with chronic kidney disease, CKD. 56. Based on the data, what is the nurse's priority action? A. Administer furosemide as prescribed. B. Restrict dietary potassium intake. C. Notify the healthcare provider immediately. D. Increase fluid intake. 57. A client with heart failure has the following data: BP 160 over 100 mmHg, HR 120 BPM, crackles in the lungs, and SpO2 88% on room air. What is the nurse's priority action? A. Start oxygen therapy. B. Administer IV furosemide. C. Monitor intake and output. D. Restrict fluid intake. 58. A nurse is assessing a client who had a stroke. The client has right-sided weakness and slurred speech. What is the priority intervention? A. Place the client on aspiration precautions. B. Perform passive range of motion exercises. C. Obtain a swallow evaluation. D. Notify the healthcare provider. 59. A client is admitted with suspected meningitis. Which intervention should the nurse implement first? A. Obtain a lumbar puncture for CSF analysis. B. Administer prescribed IV antibiotics. C. Isolate the client with droplet precautions. D. Monitor the client's neurologic status. 60. A nurse is caring for a client with diabetic nephropathy who has a creatinine of 2.5 mg/dl and a BUN of 45 mg per dl. Which medication order should the nurse question? A. Furosemide 40 mg IV. B. Lisinopril 10 mg PO daily. C. Metformin 500 mg PO daily. D. Insulin glargine 20 units subcutaneously. Questions 61 to 65. Psychiatry and mental health. 61. A nurse is caring for a client with schizophrenia who is experiencing auditory hallucinations. The client states, "The voices are telling me to harm myself." What is the nurse's priority action? A. Ask the client what the voices are saying. B. Administer prescribed antipsychotic medication. C. Place the client on one-to-one observation. D. Document the client's statement in the medical record. 62. A client with bipolar disorder is admitted in a manic state. Which intervention should the nurse include in the plan of care? Select all that apply. A. Provide high-calorie finger foods. B. Set consistent limits on inappropriate behaviors. C. Assign the client to group therapy sessions. D. Maintain a low-stimulation environment. E. Encourage frequent physical activity. 63. A client with major depressive disorder is started on fluoxetine. Which statement by the client indicates a need for further teaching? A. It might take a few weeks before I feel better. B. I will call my provider if I have thoughts of harming myself. C. I can stop taking this medication once I feel better. D. I might experience some nausea or headaches. 64. A nurse is caring for a client with generalized anxiety disorder who is experiencing a panic attack. What is the priority nursing action? A. Administer prescribed lorazepam. B. Encourage the client to verbalize feelings. C. Remain with the client and provide reassurance. D. Teach the client deep breathing techniques. 65. A client with a history of substance abuse disorder is admitted with withdrawal symptoms. Which finding requires immediate intervention? A. Blood pressure of 160 over 100 millimeters. B. Tremors in both hands. C. Reports of nausea and vomiting. D. Visual hallucinations of insects on the wall. Questions 66 to 70. Prioritization, matrix, and drag and drop. 66. A nurse is caring for a client with borderline personality disorder who is threatening self-harm. What is the nurse's priority action? A. Discuss the consequences of self-harm with the client. B. Establish a no-harm contract with the client. C. Assign the client to a private room for reflection. D. Notify the healthcare provider immediately. Matrix question 67 to 68. Scenario. A client is admitted with a diagnosis of Alzheimer's disease and is experiencing increased confusion and agitation in the evening. Select appropriate interventions. Intervention. Appropriate or not appropriate. 1. Provide a calm, well-lit environment. 2. Use reality orientation techniques. 3. Encourage family members to visit. 4. Administer prescribed antipsychotic medications. 5. Allow the client to nap frequently. Drag and drop question 69 to 70. Scenario. Arrange the following nursing interventions in the order of priority for a client experiencing suicidal ideation. A. Place the client on one-to-one observation. B. Assess the client for a specific suicide plan. C. Notify the healthcare provider. D. Remove potentially harmful objects from the room. E. Document the client's statements and actions. Correct order. Questions 71 to 75. Trend and critical thinking. Trend question. Scenario. A client with anorexia nervosa has the following data. 71. Based on the trend, what is the nurse's priority intervention? A. Start IV potassium replacement therapy. B. Encourage the client to eat small, frequent meals. C. Notify the healthcare provider immediately. D. Initiate cardiac monitoring. 72. A client is admitted to a psychiatric unit for suicidal ideation. The client expresses feelings of hopelessness. Which statement by the nurse demonstrates therapeutic communication? A. You have so much to live for. B. Can you tell me more about what you're feeling? C. Don't worry. We're here to help you feel better. D. Let's focus on positive things in your life. 73. A client with obsessive-compulsive disorder, OCD, spends several hours a day washing their hands. What is the nurse's best intervention? A. Restrict the client's access to soap and water. B. Encourage the client to verbalize the purpose of the behavior. C. Set a time limit for hand washing and enforce it consistently. D. Teach the client relaxation techniques to reduce anxiety. 74. A client with schizophrenia is prescribed haloperidol. The nurse notes that the client has a shuffling gait, drooling, and tremors. What is the nurse's priority action? A. Notify the healthcare provider immediately. B. Administer benztropine as prescribed. C. Hold the next dose of haloperidol. D. Monitor the client for worsening symptoms. 75. A nurse is caring for a client with post-traumatic stress disorder, PTSD. The client is pacing and appears visibly anxious. What is the nurse's priority action? A. Encourage the client to sit and talk about their feelings. B. Provide a safe, quiet environment. C. Teach the client relaxation techniques. D. Offer the client prescribed anti-anxiety medication. Questions 76 to 80. 76. A client is admitted with burns covering 40% of their total body surface area, TBSA. The client is in the emergent phase of burn care. Which of the following interventions should the nurse implement? Select all that apply. A. Administer V-lactated Ringer's solution. B. Cover the burns with sterile dry dressings. C. Monitor for signs of hypovolemic shock. D. Administer antibiotics to prevent infection. E. Insert an indwelling urinary catheter. 77. A client with electrical burns is admitted to the burn unit. Which assessment finding is the nurse's priority? A. Blood pressure, 90/60 mmHg. B. Dark urine output. C. Pain at the burn site. D. Heart rate 110 BPM. 78. A client with third-degree burns is receiving fluid resuscitation. The nurse notes urine output of 20 ml/h, blood pressure 85/50 mmHg, and heart rate of 130 BPM. What is the nurse's priority action? A. Increase the IV fluid rate. B. Notify the healthcare provider. C. Reassess urine output in 30 minutes. D. Insert a second IV line. 79. A client with burns develops Escher on their chest, causing difficulty breathing. What is the priority nursing intervention? A. Administer oxygen via face mask. B. Prepare the client for escharotomy. C. Position the client in high Fowler's D. Monitor oxygen saturation continuously. 80. A nurse is preparing to discharge a client who has partial thickness burns on their arms and legs. Which instruction should the nurse include in the discharge teaching? A. Apply lotion to the healed areas daily. B. Avoid sun exposure for at least 6 months. C. Perform dressing changes with sterile gloves. D. Limit fluid intake to prevent edema. Questions 81 to 85. 81. A client is admitted with exacerbation of chronic obstructive pulmonary disease, COPD. Which of the following interventions should the nurse include in the client's plan of care? Select all that apply. A. Encourage pursed lip breathing. B. Administer oxygen at 6 Lmin via nasal cannula. C. Position the client in high Fowler's D. Schedule chest physiotherapy before meals. E. Provide a high carbohydrate diet. 82. A nurse is caring for a client with pneumonia. Which finding requires immediate intervention? A. Oxygen saturation of 92% on room air. B. Productive cough with green sputum. C. Respiratory rate of 28 breaths per minute. D. Use of accessory muscles for breathing. Trend question. Scenario. A client with asthma is admitted for acute respiratory distress. Review the following data. 83. Based on the trend, what is the nurse's priority action? A. Increase oxygen delivery. B. Notify the healthcare provider. C. Administer a nebulized bronchodilator. D. Prepare for emergency intubation. 84. Nurse is preparing to administer albuterol via a metered dose inhaler, MDI, to a client with asthma. Which instruction should the nurse provide? A. Hold your breath for 10 seconds after inhaling the medication. B. Exhale deeply into the inhaler before pressing the canister. C. Rinse your mouth thoroughly after using this medication. D. Take this medication only at bedtime. 85. A client with a chest tube following a pneumothorax reports increased shortness of breath. The nurse observes that there is no fluctuation in the water seal chamber. What is the nurse's next action? A. Reposition the client to improve drainage. B. Assess the chest tube system for kinks or obstructions. C. Notify the healthcare provider immediately. D. Clamp the chest tube near the insertion site. Questions 86 to 90. 86. A client with heart failure is receiving IV furosemide. Which finding indicates the medication is effective? A. Weight loss of 2 pounds in 24 hours. B. Heart rate of 110 BPM. C. BP of 140/90 mHg. D. Crackles heard in both lung bases. 87. A client is admitted with atrial fibrillation and a heart rate of 140 BPM. Which medication does the nurse anticipate administering? A. Amiodarone. B. Atropine. C. Epinephrine. D. Furosemide. 88. A nurse is caring for a client with endocarditis. Which assessment finding requires immediate intervention? A. Splinter hemorrhages in the nail beds. B. Pain in the right lower leg. C. Fatigue and malaise. D. New onset of a loud heart murmur. 89. A client is admitted with a suspected pulmonary embolism. What is the nurse's priority action? A. Administer prescribed anticoagulants. B. Place the client in high Fowler's position. C. Prepare the client for a CT scan. D. Start oxygen therapy. 90. A client with peripheral artery disease reports leg pain while walking that is relieved with rest. What instruction should the nurse provide? A. Elevate your legs when resting. B. Wear compression stockings during the day. C. Avoid walking to prevent further pain. D. Engage in a walking program to promote circulation. NCLEX-RN mock test answers and rationale. Ready? Questions 1 to 5. Respiratory case. 1. A. Apply a non-rebreather mask. Rationale. The client is presenting with hypoxia, SpO2 82%. The priority is to deliver high concentration oxygen to improve oxygenation. A non-rebreather mask delivers up to 95% oxygen. While a bronchodilator may help with underlying airway issues, oxygen must be stabilized first. Supine positioning worsens breathing in respiratory distress, and IV fluids are not an immediate priority. 2. A. pH 7.30, PaCO2 55, HCO3 26. Rationale: COPD leads to CO2 retention, causing respiratory acidosis. The low pH and elevated PaCO2 confirm this. Other ABG options indicate either metabolic issues or respiratory alkalosis, which are not consistent with COPD exacerbation. 3. A. Prepare for intubation. Rationale: signs of worsening respiratory distress, accessory muscle use and tachycardia indicate potential respiratory failure. Intubation may be required to maintain airway patency and ensure oxygen delivery. Increasing oxygen flow or other interventions would delay life-saving measures. 4. C. Tremors. Rationale: tremors are a common side effect of bronchodilators like albuterol due to stimulation of beta-2 adrenergic receptors. Hypotension and bradycardia are not typically associated with bronchodilators, and hypoglycemia is unrelated to their mechanism of action. 5. A, B, D. Rationale: these interventions support COPD management. Daily use of prescribed inhalers prevents exacerbations, avoiding smoke reduces triggers, and vaccinations protect against infections like pneumonia and influenza. High-carb diets increase CO2 production, and monitoring oxygen levels is not typically a home intervention. Questions 6 to 10, matrix and drag and drop. Matrix question, intervention, appropriate, not appropriate. 1. Administer a 500 ml bolus of 0.9% NS, appropriate. 2. Start norepinephrine infusion, appropriate. 3. Obtain blood cultures before antibiotics. Appropriate. 4. Administer acetaminophen for fever. Appropriate. 5. Give IV potassium chloride. Not appropriate. Rationale. Fluid bolus. Replenishes intravascular volume to improve MAP and perfusion. Norepinephrine. Vasopressors maintain MAP 65 mmHg if fluids are insufficient. Blood cultures. Ensure appropriate antibiotic therapy. Acetaminophen. Reduces fever and metabolic demands. Potassium chloride. Unnecessary unless hypokalemia is present. Drag and drop. Correct order. A, C, B, D, E. Rationale. Oxygen. Address hypoxia immediately. Vitals. Assess hemodynamic stability. ECG. Identify ischemic changes. Nitroglycerin. Relieve chest pain by dilating coronary arteries. Notify provider. Communicate findings for further intervention. Questions 11 to 15. Blood transfusion and cardiac. 11. A. Stop the transfusion immediately. Rationale. Chills and back pain are signs of a transfusion reaction, requiring immediate cessation of the transfusion to prevent further exposure to the causative agent. Subsequent actions include notifying the provider and monitoring the client. 12. A, C, D, E. Rationale. Calcium gluconate stabilizes the myocardium. Sodium polystyrene sulfonate removes excess potassium. Insulin with dextrose shifts potassium intracellularly, and restricting dietary potassium prevents further elevation. IV potassium chloride worsens hyperkalemia. 13. A. Respiratory acidosis. Rationale. pH 735 with elevated PaCO2 indicates respiratory acidosis caused by CO2 retention, often due to hypoventilation or conditions like COPD. 14. A. Perform a fundal massage. Rationale. A boggy uterus signifies uterine atony, the most common cause of postpartum hemorrhage. Fundal massage stimulates contraction and reduces bleeding. Calling the provider delays critical intervention. 15. A. Administer furosemide. Rationale. Signs of fluid overload, weight gain, crackles, dyspnea indicate the need for diuretics to reduce pulmonary congestion. Fluid restriction is supportive but not immediate. Questions 16 to 20. Digoxin and CKD. 16. A. Apical pulse of 55 bpm. Rationale. Digoxin slows heart rate. If the pulse is 60 bpm, the medication is withheld to prevent bradycardia, and the provider is notified. Other values do not contraindicate administration. 17. A. Administer a fluid bolus of 500 ml 0.9% NS. Rationale. In septic shock, restoring intravascular volume is the first step. Vasopressors like norepinephrine follow if fluids alone do not maintain MAP 65 mmHg. 18. B. Perform synchronized cardioversion. Rationale. Symptomatic tachycardia with wide QRS requires immediate cardioversion to restore normal rhythm. CPR is reserved for pulseless clients. 19. A. Notify the healthcare provider. Rationale. Perineal swelling and pain suggest a hematoma, requiring surgical intervention. Delaying action could lead to complications like hemorrhage. 20. C. Spironolactone, 25 mg PO. Rationale. Spironolactone is potassium sparing and can exacerbate hyperkalemia, which is common in CKD clients. Other medications are appropriate. Questions 21 to 25. Warfarin, sepsis, and postpartum. 21. C. I will stop taking my medication if I notice bruising. Rationale. Stopping warfarin without provider direction can lead to clot formation. Clients must contact their provider if signs of bleeding occur, such as bruising. Other statements show correct understanding of warfarin management. 22. A. Prepare for intubation. Rationale. Respiratory distress in Guillain-Barré syndrome can rapidly lead to respiratory failure. Preparing for intubation ensures airway protection and adequate oxygenation. 23. A. Start a lactated Ringer's infusion. Rationale. Fluid resuscitation is the priority in the emergent phase of burn care to prevent hypovolemic shock. Other actions can follow stabilization. 24. A. Stop the transfusion immediately. Rationale: chills and back pain indicate a transfusion reaction. Stopping the transfusion is the first action to prevent further exposure. Additional steps include notifying the provider and monitoring vitals. 25. A. Administer IV furosemide. Rationale: signs of fluid overload, weight gain, crackles, decreased urine output indicate the need for diuresis to reduce fluid volume and improve respiratory function. Questions 26 to 30. ABGs, COPD, and medication administration. 26. A. Respiratory acidosis. Rationale: a low pH, elevated PaCO2, and normal HCO3 indicate respiratory acidosis, commonly caused by hypoventilation. 27. A, C, E. Rationale: wearing oxygen during sleep, avoiding smoking, and notifying the provider for low oxygen levels are essential. Increasing oxygen flow independently and using petroleum products are unsafe practices. 28. C. Facial swelling. Rationale: facial swelling, angioedema, is a life-threatening adverse effect of ACE inhibitors like lisinopril. Dizziness, dry cough, and fatigue are common but not emergencies. 29. B. Diminished breath sounds on the affected side. Rationale: diminished breath sounds may indicate pneumothorax or fluid accumulation, requiring immediate intervention. Pain, normal oxygen saturation, and blood-tinged sputum are expected findings post-thoracentesis. 30. D. I will rub the site after the injection to prevent bruising. Rationale: rubbing the site increases the risk of hematoma formation. Other statements reflect proper understanding of enoxaparin administration. Questions 31-35. DVT, CHF, and burns. 31. C. Notify the healthcare provider immediately. Rationale: redness, swelling, and warmth suggest deep vein thrombosis, DVT. Immediate evaluation is needed to prevent complications like pulmonary embolism. 32. A. Administer furosemide IV push. Rationale: signs of fluid overload, crackles, weight gain, dyspnea, require immediate diuresis. Encouraging ambulation or increasing oxygen is secondary. 33.C. Reduce the infusion rate. Rationale: flushing and itching suggest red man syndrome, a reaction to vancomycin. Slowing the infusion rate usually resolves symptoms. 34. B. Notify the surgical team to postpone surgery. Rationale: hyperkalemia increases the risk of cardiac dysrhythmias during surgery. The surgical team must be informed immediately to reschedule. 35. C. Massage the breasts and express milk manually before feeding. Rationale: massaging engorged breasts helps relieve discomfort and facilitates milk flow. Ice packs are applied after breastfeeding to reduce swelling. Questions 36 to 40. Pancreatitis, UTI, and cardiac. 36. A. Administer IV morphine as prescribed. Rationale: severe abdominal pain is a hallmark of acute pancreatitis. Pain management is the priority before addressing other needs. 37. A. Administer prescribed antibiotics. Rationale: antibiotics treat the underlying infection causing the UTI. Other actions support recovery but are not priorities. 38. B. Potassium level of 3.0 MEq per L. Rationale: hypokalemia can cause cardiac dysrhythmias, making it the most urgent finding. Elevated BNP, low ejection fraction, and low SpO2 require action, but are less immediately life-threatening. 39. C. Blood pressure of 86/48 mm Shark. Rationale: hypotension indicates possible hypovolemic shock, a critical complication in burn clients. Elevated hematocrit and potassium are expected in the emergent phase. 40. A. Hold the medication and notify the provider. Rationale: a heart rate less than 60 BPM is a contraindication for metoprolol administration. Questions 41-45. Psychiatry and mental health. 41. A. Administer prescribed NSAIDs. Rationale: NSAIDs reduce inflammation, pain, and swelling in rheumatoid arthritis. Ice and ROM exercises are supportive, but do not address inflammation directly. 42. B. Initiate neutropenic precautions. Rationale. A WBC of 1/500 IUL indicates severe neutropenia, increasing infection risk. Neutropenic precautions, e.g., isolation, avoiding crowds, are critical to prevent complications. 43. C. Notify the healthcare provider immediately. Rationale. Drooling and inspiratory stridor suggest airway obstruction from epiglottitis. Immediate provider notification ensures airway protection. 44. C. Let me teach you how to empty the ostomy pouch. Rationale. Teaching practical skills empowers clients and addresses their concerns. Support groups and emotional reassurance are secondary. 45. A. Continuous bubbling in the water seal chamber. Rationale. Continuous. Bubbling indicates an air leak, which requires immediate intervention to maintain lung re-expansion. Mild pain and serosanguineous drainage are expected. Questions 46 to 50. Burns and acute care. 46. B. Urine ketones. Rationale. Ketones confirm diabetic ketoacidosis, DKA, in the context of hyperglycemia and rapid breathing. Other labs may provide supportive information, but do not confirm DKA. 47. C. I will stop taking my medication if I notice bruising. Rationale. Clients should not stop warfarin without provider guidance, even with bleeding signs. INR checks and consistent administration are essential. 48. B. Assess the client's vital capacity. Rationale. Guillain-Barré syndrome may cause respiratory muscle weakness, requiring assessment of lung function, vital capacity. Positioning and oxygen follow the assessment. 49. B. Notify the provider of potential nephrotoxicity. Rationale. Elevated BUN and creatinine suggest renal impairment, possibly caused by nephrotoxic antibiotics. Timely intervention prevents further damage. 50. A, C, D, E. Rationale. Pancreatic enzymes improve digestion, chest physiotherapy clears secretions, fluids prevent dehydration, and infection monitoring reduces complications. Low-calorie diets are contraindicated. Questions 51, 55. Postpartum, TPN, and anticoagulation. 51. A. Administer prescribed antibiotics. Rationale. Foul-smelling discharge and fever indicate endometritis. Early antibiotic therapy prevents sepsis. 52. B. Administer sliding scale insulin as prescribed. Rationale. Elevated glucose in TPN is treated with insulin. Adjusting TPN rates requires provider input, and monitoring alone is insufficient. 53. C. Check the patency of the NG tube. Rationale. Nausea and distension suggest obstruction. Checking patency ensures the tube functions correctly. 54. B. Administer nystatin as prescribed. Rationale. White patches suggest oral thrush, treated with antifungal medication. Other measures support oral care, but do not resolve the infection. 55. A. Stop the heparin infusion immediately. Rationale. An APTT of 90 seconds is above the therapeutic range, increasing bleeding risk. Stopping heparin prevents further complications. Questions 56 to 60. Trend, cardiac, and renal. 56. C. Notify the healthcare provider immediately. Rationale. Worsening hyperkalemia, hypertension, and oliguria suggest kidney failure, requiring urgent intervention. 57. B. Administer IV furosemide. Rationale. IV furosemide reduces fluid overload, improving oxygenation and reducing blood pressure. 58. A. Place the client on aspiration precautions. Rationale. Stroke-related dysphagia increases aspiration risk. Positioning and swallow evaluations follow. 59. C. Isolate the client with droplet precautions. Rationale. Meningitis is contagious, requiring isolation to prevent transmission. Antibiotics follow after isolation. 60. C. Metformin 500 mg PO daily. Rationale. Metformin is contraindicated in renal impairment due to the risk of lactic acidosis. Questions 61-65. Psychiatric nursing. 61. C. Place the client on one-to-one observation. Rationale. The client is at immediate risk for self-harm. Close observation ensures safety. A, B, D, E. Rationale: high-calorie finger foods, setting limits, low stimulation environments, and physical activity address manic behaviors. Group therapy may overstimulate the client. 63. C. I can stop taking this medication once I feel better. Rationale: antidepressants must be tapered under provider supervision. Abrupt discontinuation increases the risk of withdrawal. 64. C. Remain with the client and provide reassurance. Rationale: staying with the client reduces panic and provides a calming presence. Deep breathing techniques can follow once the client stabilizes. 65. D. Visual hallucinations of insects on the wall. Rationale: hallucinations in withdrawal indicate severe delirium tremens, requiring immediate intervention to prevent complications like seizures. Questions 66 to 70. Matrix and drag and drop. 66. B. Establish a no-harm contract with the client. Rationale: a no-harm contract promotes safety and engages the client in their care. Matrix question. Intervention: appropriate, not appropriate. 1. Provide a calm, well-lit environment. Appropriate. 2. Use reality orientation techniques. Not appropriate. 3. Encourage family members to visit. Appropriate. 4. Administer prescribed antipsychotics. Appropriate. 5. Allow the client to nap frequently. Not appropriate. Rationale: a calm, well-lit environment reduces confusion. Encouraging family visits can help with orientation. Reality orientation techniques are not helpful in advanced Alzheimer's. Instead, validation therapy is better. Napping frequently may worsen nighttime agitation. Antipsychotics can help with severe agitation when prescribed. Drag and drop. Correct order: B, D, A, C, E. Rationale: assess for a specific suicide plan. B. Understanding the risk level is critical. Remove harmful objects. D. Eliminate potential tools for self-harm. Place on one-to-one observation. A. Ensures constant supervision. Notify the healthcare provider. C. Communicate findings and initiate further care. Document the client's statements and actions. E. Ensure thorough records for continuity of care. Questions 71 to 75. Trend and critical thinking. 71. A. Start IV potassium replacement therapy. Rationale: severe hypokalemia, K+, 3.0 MEq per L, increases the risk of cardiac dysrhythmias. Immediate potassium replacement is critical to prevent life-threatening complications. Other interventions can follow stabilization. 72. B. Can you tell me more about what you're feeling? Rationale: open-ended questions encourage the client to share their feelings and explore the reasons for hopelessness. Other responses are dismissive or invalidate the client's emotions. 73. C. Set a time limit for hand washing and enforce it consistently. Rationale: setting limits reduces compulsive behavior while maintaining control over anxiety. Restricting access to soap and water or focusing on relaxation without addressing the compulsion is not effective. 74. B. Administer benztropine as prescribed. Rationale: shuffling gait, drooling, and tremors indicate extrapyramidal symptoms, EPS, caused by haloperidol. Benztropine, an anticholinergic, alleviates these symptoms. Monitoring or holding the medication delays treatment. 75. B. Provide a safe, quiet environment. Rationale: in PTSD, reducing external stimuli and creating a calm environment help de-escalate anxiety. Other interventions, such as medication or teaching relaxation techniques, follow stabilization. Questions 76 to 80. Burns. 76. A, B, C, E. Rationale: IV fluids prevent hypovolemic shock. Sterile dry dressings reduce infection risk. Monitoring for shock is critical during the emergent phase. Antibiotics are not typically prophylactic in burns. 77. B. Dark urine output. Rationale: dark urine suggests myoglobinuria, a sign of rhabdomyolysis, which can lead to acute kidney injury. Hypotension and tachycardia are concerning, but not as immediately life-threatening. 78. A. Increase the IV fluid rate. Rationale: low urine output, hypotension, and tachycardia suggest inadequate fluid resuscitation. Increasing the fluid rate restores circulation and prevents shock. 79. B. Prepare the client for escharotomy. Rationale: chest eschar can restrict breathing. An escharotomy releases pressure, restoring ventilation. 80. B. Avoid sun exposure for at least 6 months. Rationale: sun exposure can damage newly healed skin. Moisturizing healed areas is encouraged, but sterile gloves for dressing changes are unnecessary at discharge. Questions 81 to 85. Respiratory. 81. A, C, D. Rationale: pursed lip breathing improves ventilation. High Fowler's reduces work of breathing. Chest physiotherapy clears secretions. High oxygen flow and carb-heavy diets are contraindicated in COPD. 82. D. Use of accessory muscles for breathing. Rationale: accessory muscle use indicates impending respiratory failure, requiring immediate intervention. 83. D. Prepare for emergency intubation. Rationale: deterioration, SpO2 85%, absent lung sounds, suggests respiratory failure, requiring intubation. 84. A. Hold your breath for 10 seconds after inhaling the medication. Rationale: holding the breath maximizes medication absorption in the lungs. Rinsing the mouth is for corticosteroids, not albuterol. 85. B. Assess the chest tube system for kinks or obstructions. Rationale: no fluctuation in the water seal chamber suggests a blockage. Fixing the system restores function. Questions 86 to 90. Cardio. 86. A. Weight loss of 2 pounds in 24 hours. Rationale: weight loss reflects fluid removal, indicating effective diuresis. 87. A. Amiodarone. Rationale: amiodarone treats atrial fibrillation by controlling the heart rate. Atropine and epinephrine are not indicated. 88. D. New onset of a loud heart murmur. Rationale: a new murmur may indicate valve damage or complications, requiring immediate evaluation. 89. D. Start oxygen therapy. Rationale: oxygen reduces hypoxia caused by a pulmonary embolism. Other interventions follow stabilization. 90. D. Engage in a walking program to promote circulation. Rationale: walking improves collateral circulation in peripheral artery disease. Elevating legs in compression stockings worsen symptoms.
Great job, everyone! That's the end of today's NCLEX-RN mock test. I hope you found these questions and rationales helpful. If you did, don't forget to like, subscribe, and hit the notification bell for more NCLEX tips, mock tests, and nursing strategies. Let me know in the comments how many you got right and what topics you want to see next. Keep practicing, stay focused, and remember, you're one step closer to becoming an RN. This is Nurse Marcia, and I'll see you in the next video. Bye.